So this presentation is about cognitive behavioral therapy, so CBT. So cognitive behavioral therapy, it's a form of psychotherapy that looks at how we think or and our reaction to those thoughts. There's not one therapy that is cognitive behavior. There are many therapies that are put together to get cognitive behavioral therapy. They would include rational emotive behavior therapy, rational behavior therapy, rational living therapy, cognitive therapy, and dialectic behavior therapy. There's a short-term goal-oriented therapy that has a hands-on idea toward problem solving. The history of CBT, again, cognitive behavioral therapy, is invented by Aaron Beck in 1960. He was watching his clients as they went through their sessions. They were using self-talk or talking to themselves during the sessions about what they needed to do, how to do it, and when they wanted to do it. This was the development of the connection between thoughts and feelings. Beck called it cognitive therapy after finding the importance placed on thinking. Negative thinking can also block us from seeing what we need to do and seeing the correct direction we need to go. This type of therapy is used for many disorders, phobias, addictions, depression, and anxiety. CBT, cognitive behavioral therapy characteristics are based on the idea that our thoughts cause how we feel and act. We can change these ideas because of this fact. So cognitive behavior therapy is one of the quickest therapies to obtain results. The reason that cognitive behavior therapy sees quick results is that it is instructive and that the clients have homework. Many therapists want to build a relationship with the client. It tends to build trust and make the client want to continue to work on their problems. So with CBT, therapist works on the relationship and teaches them how to look at themselves, their problems, and many solutions. CBT is a collaboration between the client and the therapist. They work on finding out what the problems are and also to work on the solutions. Each has a different role and need to perform them accordingly. So CBT doesn't tell people how to feel. CBT therapists ask questions. Clients need to ask questions of themselves. CBT has a specific items that they need to do or accomplish. There are techniques and concepts used during their sessions. CBT is an educational model. Clients need to learn what they have learned and find a new way. Meta-analysis is using statistical methods to combine results of single studies. By combining the information, you can have strength in the review of the findings. Meta-analysis is done systematically, follows certain criteria, pulls results, and is based on quantitative analysis. The goal of meta-analysis is to look at the effects of the subsets of the participants, the use of the hypothesis for the clinical study, and small sample sizes and statistical significance. Meta-analysis, of course, is not without its critics. One criticism is the way the comparison is done between the studies, and attention to moderate variables is another consideration. When looking, because of these variables, the outcome of the study may be different. There are variables that are looked at when deciding which meta-analysis are looked at. So random clinical traits, effective sizes, outliers, inclusion of moderator analysis. The sample that was looked at had 16 meta-analyses, which had 9,995 subjects in 332 studies. 562 comparisons of 16 disorders. Some of these disorders included depression, anxiety disorder, panic disorder, social phobia, obsessive compulsive disorder, PTSD, schizophrenia, marital distress, anger, eating disorders, and pain. There are two different control groups. Controlled conditions. Uncontrolled is the amount of the improvement within the group from the pre-treatment and post-treatment. Uncontrolled effect sizes are less preferable because the control on the variable is too hard to do. Using meta-analysis with cognitive behavioral therapy was meant to answer certain questions for different types of disorders. Through the meta-analysis, cognitive behavioral therapy was seen as being highly effective with depression, both adult and adolescent, anxiety disorder, panic disorder, social phobia, PTSD, and childhood depressive and anxiety disorder. With this study, wanting to find out how the treatment worked after the ending of the prescribed treatment, the findings showed that cognitive behavioral therapy worked and was effective for clients after they stopped going to treatment. Cognitive therapy showed very effective post-traumatic results on anxiety disorders, depression, OCD, schizophrenia, panic, and sexual offending. Recommendations for future meta-analysis would be to continue to evaluate the effective cognitive behavioral therapy and to look at a variety of disorders and compare cognitive behavioral therapy with alternative treatment. The use of meta-analysis will continue to be used as an evaluation of the many disorders and therapies that can be used to assimilate the information and make it available for therapists. Thanks. Have a good day.